As someone who injects patients every day, I think it's also important to share my own experience. So today I'll explain where I get Jeuveau, why I focus on those areas, and why it's not a one-size-fits-all treatment. Again, I want to reinforce that everyone's different. This is just my take on what areas I want to do injectables, but there's so many areas on the face where you can do it. So why do I get injectables? The main reason I get injectables is for anti-aging purposes. I don't want to have static lines on my forehead or my glabella, and that's why I get it. This is full transparency right here. No gatekeeping. Okay. So let's start with where I inject Jeuveau, marking my forehead. I do about 10 units on my forehead. So I'm about a month out from my injection. I have, as you can see, I have very minimal movement on my forehead, just how I like it. And again, I used about 10 units all over my frontalis or my forehead area. And we're gonna move on to my glabella. So for my glabella, I get about 16 units, and each point gets roughly maybe like 3 to 4 units, a little bit lower on the tails of my corrugator, just because I want a little bit of movement there. But there's literally, it's frozen. On my glabella region, I go around 16 units because I don't want any what we call 11 lines in that area. Over time, if you keep making the same expression, you're gonna end up with line that kind of like goes from here all the way down here. It also gives you actually a little bit of lifting in this area when you do it, because this is a depressor muscle. All three of them is a depressor muscle, so essentially it pulls your muscle down. When you get neuromodulator in that area, it actually relaxes it, so it does the opposite. So instead of that being able to pull down, it'll actually like open up a little bit. So I'll give you a little bit of a lift in that area. And yeah. Now let's move on to the crow's feet area. This, I don't really dose that much. I do like a little bit of a lifted appearance on the tail end of my brows. So I do a little bit of an eyebrow lift. So I do a few units, maybe 2 and 2, 2 and 3. And then I go a little bit around here, and that's about it. I get maybe like 8 units to 10 units in that area. Again, injectables, especially neuromodulator, it's customizable to each patient. Not everyone's gonna want a brow lift, so instead of doing a little bit of a brow lift, I wouldn't inject right here. I'll probably just focus most of that injection point just lateral right here. Again, for people that want more of a natural look, I don't dose a lot on the lateral cheek right here, because when you do that, when you smile, this actually doesn't lift up as much, which kind of gives you an unnatural appearance, especially when you're animating, you're laughing, you're smiling. So I try to minimize the dosage in these areas just to smooth it out. Another thing I would like to point out is that on older patients, this could be completely different. The dosing will be completely different. We have to look at your eyelid position and your eyebrow position. If they're on the lower end, we want to think about maybe dosing you a little bit less on the frontalis area to prevent eyebrow drooping or eyelid drooping and stuff like that. So it's very important that you go to a provider that is very experienced in terms of assessing this stuff. Moving on, we're going to be talking about bunny lines. So the bunny lines are the lines that form around here. For patients that have really strong bunny lines, I recommend, so when you're treating your upper 3, you also want to treat on the bunny lines, because when you only do the upper 3 area, this muscle will actually overcompensate, meaning like the muscle heel will try to work harder because everything else is weak. So you want to touch maybe just a little bit there, just so you don't get deeper lines in that area. I do about 6 to 8 units in this area. Again, just to kind of soften it out and give it more of a natural look. Every now and then I like to get my masseter injections done. That is the muscle that is right around here on your jawline. So a lot of times I have patients bite down, and then from there we can assess how much units needs to be used in that area. So for me, I normally go maybe around 15 to 20 units depending on how long I have, haven't gotten it done. I probably get it done maybe once a year, sometimes once every like year and a half or so. Okay, for masseters, again, it depends on why you're getting it done. Some people like to get it for aesthetic reasons. It does help kind of slim down your jaw area. Some people do it because of TMJ or pain. Depends on how strong your muscle is and what it's for, then we'll figure out like how much units you get in that area. Personally, for me, I get about 15 to 20 units. Again, it's depending on how strong my muscle is at that time and how long my last injection was. Another area I like to get done or I like to inject is my DAO. Again, I'm about a month out, so you can't really see much movement right now, but essentially it's a muscle that pulls the corners of your mouth down. So putting a little bit of injection in that area or jabot, it's gonna relax it and actually give you a little bit of an upturn of the corners of your lip. It's very subtle, but I think it's a game changer. So if you've never tried it before, you should try it. But essentially, you just make a sad face. So again, I can't make it, but it'll be right around here. And I go maybe 2 units on each side. Another area I really like to do is my chin. I have dimpling on my chin, so whenever I talk, I animate, I get like this, what we call like orange peel texture. So I do, it's already coming back right now. So normally what I'll do is I'll probably do like 6 to 8 units in that area, depending on, you know, the strength. So I'll do here, here, and about here. So normally when I see patients and they come in telling me they have concerns about the laxity or like they feel like their face on the lower half of their face feels like it's falling or drooping down, a good option is to do what we call meso injection. I don't personally do it for myself because I just don't think I need it at this time or at this moment, but it's essentially little injections all over your cheeks. So it runs from here, and we'll do about 20 units, and it's just right underneath the skin. And what that does, it just gives it a little bit of a tug, and it tightens this area ever so slightly. Again, for pre-joweling, DAO is also a good option to inject, which is this area, because it kind of gives it a little bit of support, a little bit of lift there. Lastly, I want to talk about platysmal band. Platysmal band is the sheet of muscle that runs from here and goes all the way down on your neck. A lot of times, you know, we don't really think about this area, but when we make expressions, laugh, all of that stuff, you do this, and then there's like little bands that actually run from here, and what that does, it kind of gives some tension and pull in this area. So I like to treat that on, if you're a right candidate, it's such a good treatment. But what I would do is do a little injection around there. I usually grab the muscle and I'll inject it from that area, and it varies on how much units you need in this area. It really depends on how strong your muscles are there. A lot of my older patients really love this treatment. But this is just my take on what areas I want to do injectables, but there's so many areas on the face where you can do it. You can even do it on your nose if you want your nose to appear a little bit slimmer. It's actually a good treatment. You just do a few units, anywhere between 2 to 4 on each side. So you'll do right on the nostril right here. I also like to do a little bit on the tip right there. You can even do on the bottom and right here. And what that's gonna do is actually kind of slim this lower half of your nose down and give you a little bit of a projected, more pointier nose. This is what works for me, but the units I spoke about might not work for you. That's why it's important to seek a qualified provider that will take the time to assess and help you achieve your aesthetic goals.